Hi everyone, Leiann here again, back with another video this week. Next week we will be joined with Dr. Jeff again as he'll be back from vacation, but until then, let's get into the topic this week. This week we will be talking about the different types of imaging that you can get. We'll be specifically talking about CT scans, X-ray scans, and MRI scans. First we'll be talking about X-ray scans. X-ray scans involve electromagnetic energy that we pass through the body and its structures, and depending on the structure and the tissue, it allows different amounts of energy beams to pass through. And that's how we identify what structure we're looking at on the image, depending on how dense that structure is in the X-ray scan. Next, we'll be talking about CT scans. CT stands for computed tomography, and it's a combination of using X-rays and computer technology. They show detailed images of your bones, muscles, fat, organs, and blood vessels. And it's more detailed than just the standard X-ray because unlike the standard X-rays, CT X-ray beams, they go around in a circle around the patient and it gives you different views of the structure, whereas the standard X-rays, the beams just go in a straight line and they only are directed towards one structure. Whereas with CT, you go all around the body and you can get like a 3D point of view of the structure, and then the computer will take that 3D image and put it into a 2D format. The third imaging type we're going to talk about is MRI. MRI stands for magnetic resonance imaging, and these use large magnets and radio frequencies plus the use of computers to produce detailed images of your organs and other structures. Now MRIs, they use a tube that you put the patient in, and then it'll create a magnetic field around the patient and release radio waves. Those radio waves will then excite the atoms in your body and make the atoms emit their own radio signals, which then the computer absorbs, takes in, computes, and then produces the image. So the question is, what is the difference between these three imaging types? And when is it appropriate to get which imaging? Well, to start off, X-rays are the fastest imaging type, so they're usually what you could call the first line of defense. It only takes a couple minutes, and it's used to identify fractures, dislocations, misalignments, or narrowing of joint spaces. However, for bone injuries that are more subtle, it won't show up in X-ray scans. And then for CT scans, they're more highly detailed compared to X-rays, and they are fairly fast, but in comparison to X-rays, they are slower. And we use CT scans to identify, other than bone fractures, we can also identify injuries to organs or also blood clots. And then lastly is MRI scans. MRI scans are different than the other two, mainly in that it doesn't use any radiation, whereas the other two imaging types do. MRIs are also more detailed than X-rays, so those subtle injuries MRIs are able to pick up. And they can also pick up on cartilage loss, joint inflammation, nerve compression, spinal injuries, and also torn ligaments or tendons. I'm sure you yourself or someone you know has gotten imaging done before, and maybe you've wondered why the doctor told you to get the imaging that they did. I hope that this week's video gave you a little insight into the different imaging types and what they can do for you. Well, I hope you found this week's video helpful on the different imaging types. Please give this video a thumbs up, please comment, subscribe, share with your friends. And if you have any questions or if you have any content that you want me or Dr. Jeff to talk about, feel free to email us or message us on our social medias, and we'll be happy to make a video on it. And as always, here at Goldsworthy Chiropractic, we got your back.